Well, welcome back to the 7 o'clock talk. And tonight we're going to talk about amino acids, the importance of amino acids, where you can get your amino acids from, and kind of how they affect you. Because most people think about amino acids as the building blocks of your muscles, but it affects a whole lot more than just your muscles. It affects mood. It affects, of course, protein synthesis, muscles, um,
Immune system.
immune system, hormones, all of it. So take it away. Put her on the spot.
Well, I'll tell you where you can find them. So there's essentials and non-essentials. The essentials um, you can't create on your own in your own body, so you need to eat them or supplement them. Preferably eat them. Uh, of course, they're going to go in meat products. So high quality meat, eggs, dairy, seafood. Remember to get wild caught seafood. Just skip the farm raised. They raise them in toxins because they're floating around in their own feces. So you want to skip anything that's farm raised. But if you don't like meat, or you are a vegetarian or a vegan or whatever, you've got good options. Quinoa, if I said that right. Buckwheat is really good. Buckwheat flour, it's so flavorful, but you can make it savory or you can make it sweet. Um, Good soy products, like actual soy products, and then you're going to get in your soy. You're also going to get, if you're female, you're going to get your phytoestrogens, which are really good for you. And then peanuts are a good option, but not really. They're good for the fact that they have all the amino acids, but peanuts are used, they're an absorber. So they're in the ground, so they got a lot of mycotoxins, mold, and then they have a lot of toxins from the soil because they absorb everything. And they actually use those to clean up chemicals from fields. So
Bioaccumulators.
yeah, so even though everybody loves peanut butter and peanuts, um, if they were grown organically with no chemicals, they'd probably be a good choice for you. But just be careful if you're sensitive to molds. But they do have all of the amino acids in there for you.
So the amino acids themselves, like I said, building blocks of protein. They help with digestion and metabolism. So your stomach has a slime layer to it, and that's made of amino acids. Glutamate, glutamine, glycine, all of these things are parts of that. And so if you don't get your amino acids in, the body will start to break down the stomach for its amino acids, and then that starts to cause that process of leaky gut. Also, it has a lot to do with your hormones and your neurotransmitters. We use it a lot with the neurotransmitters because when we do our testing, we can see the neurotransmitters and then we immediately start to help them with their hormones and their neurotransmitters. And that gives people a sense of hope because it's the first time they felt good and they don't feel like they're dying and they're not tired and they're not depressed. It just really is a game changer for those people who have anxiety and depression that's caused from a loss of the neurotransmitters. Muscle growth and repair, as I said, immune function. These amino acids deal a lot with the immune system and balancing the immune system. Remember, the first immune system is that secretory IgA in the stomach. And if you don't maintain that with good amino acids and it breaks down, then all of a sudden things get through to the bloodstream that are not supposed to get through to the bloodstream. Here's the thing that women love, and man, I just really wish I could get the amino acids. It helps with skin,
I
hair,
don't have a
and
problem
nails.
with that.
No, she does not.
And I grew wonderful children and I gave it all to them too.
Yeah, they have thick, healthy hair. So those are some of the things that we see.
Getting back to hair though, I used to work with a surgeon, and he would come in, and the first thing that he would do was look at people's legs. Because if you don't grow hair on your legs or have very, very thin hair on your legs, it means you don't have any extra. So you're not going to put any energy into making hair. So just a tidbit from a surgeon that I used to work with, and I just loved him, even though he's not here with us anymore. He would always check people's legs, and if you grew thick hair on your legs, it meant that you were turning the corner because then you had extra.
The other thing to think about with that too is diabetics. They will lose hair starting at their feet and moving up the leg. And that's a problem with insulin also. And if you have amino acid problems, you probably have problems with insulin because you're not getting proper nutrition.
And circulation causes that problem too. So.
Yep. Which is
It's
all
all the big circle.
it's all related.
So if you look down and you think, oh, my legs are shiny and I don't have any hair on them, you might need a little extra something.
You need to get it checked out because that's these little physical symptom signs are things that are telling you that those root causes of problems, whether it be genetics, inflammation, high insulin, um, poor diet, whatever the root cause of your problem is, it's starting to express itself in the trunk of the tree with metabolic syndrome or insulin resistance. We've been talking a lot about neurodegenerative diseases. Those are all the diagnoses in the tree. And then when you come out to the leaves are just numerous symptoms that you can have. And that's why they call it root cause medicine, because you want to get down to this bottom layer and do everything that you can in this bottom layer to control what happens in that trunk of the tree. And that's how all of these things are actually related. And you cannot separate, tease out any of these things without seeing how they interrelate. And we've been doing this long enough that we see that the hormones are related to the gut and related to the brain and related to the immune function and related to mental health and related to the ability to grow muscle, the ability to gain weight, the ability to lose weight.
Yep, all of those symptoms. So symptoms are your body's way of crying for help.
That's the check engine light of the body without the light.
It's trying to talk to you.
Yep. We just don't listen.
Or we don't know how to listen.
That's true. Because you have a lot of people. She does a lot of the patient education. She spends a lot of time with the patients and teaching them how to listen to their bodies.
Well, and sometimes you have to take a step back and slow it down. And that's where I know we're off tangent here, but that's where we use our elimination diet. It really resets you and takes you back and lets you build back up so that you hear, feel, and you learn to listen to who you are and how you work with the things that you put in your body.
Yep.
Like these foods that help you with your amino acids.
And like I said, it's all related. There is no getting away from it. So, kind of to summarize it, especially talking about amino acids, and I don't like talking about treating. I don't like talking about treatment in that, oh, hey, if you've got this symptom, take this supplement, because that's just green pharmacy. What we like to say is if you are depressed, if you are anxious, you need to get some testing, and then we can start to address the things that are happening according to the tests and get to the root cause and eliminate it.
Make sure you don't have a deficiency, because you can always go to the doctor and get an antidepressant. However, that is misdiagnosed a lot. So remember, food is medicine, and you may need to supplement, but ultimately you supplement for a short term while your body builds itself up with actual real good food. And we have products that we trust and that we actually use every day. And he likes to work out. So some people can't eat enough to get what they need. And there's where your athletes are supplementing themselves. But most people can find high quality food and get enough in every day, unless you have other problems. But we're here to help.
Yeah.
So, Dr. Miller, Nurse Jessica, and we are Integrated Health of Indiana. And you can reach us at Indiana Back Doc.
Dr. Miller, Dr. Miller at integratedhealthofindiana.com, Mrs. Indiana Back Doc at gmail.com, or call the clinic and schedule a 20-minute appointment. That is a complimentary consult. We will talk to you. We learn lots about you, and then we help get you on your way to taking care of these things.
And then you'll get to see Tina or talk to Tina. And her number, our number, the clinic's number is 812-346-1757.
Have a great night. We'll see you next time. Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.